Okay, Sarah, so you've been on the 1.5 day HIP course here. Tell us a little bit about how you found that.
It's been really, really good. We've all benefited from all of the up-to-date evidence and manual therapy techniques. Some of it's revision and some of it's just like basically reinforcing that we're doing the right thing. But loads of it, especially the new evidence base, has been fantastic, and we've all really enjoyed it, and loads of new interesting stuff. And I think we all feel clinically stronger at helping diagnose, assessing, treating hip and groin.
Fantastic. And what sort of patients do you see?
Really varied. We treat police officers from the whole of the north of the country, everybody from Scotland, Northern Ireland, Wales, Nottinghamshire upwards, and so different surgeons have very different input, as well as lots of different injuries caused by the job. And you've also got elements of police officers who are injured on duty, who might be chasing after a burglar or something, but then you've also got firearms who could have been sat in a really awkward position in a bush for a while trying to stalk out something or something like that. So it's really varied, the type of patient we have. But we also have retired officers who've got new hips, or all those things. So it's really, really varied, and we see huge cross range.
And do you think that you can take some of the clinical reasoning and the techniques from the course and use them with your clients?
The clinical reasoning 100%, because all best practice should be looking for that. With regard to the techniques, we're in a very fortunate situation with our resources, so I think that again we can use the majority of those, obviously client depending. The only thing that we won't be able to use as much as we would like is that we're only treating for 2 weeks, and therefore there's certain things to do with outcome measures and stuff that we're going to be trying to push out to the satellite clinicians who look after our police, to look at maybe doing more longitudinal outcome measures, because obviously we can only measure for 2 weeks, but we will be using them in those 2 weeks.
Sure.
But for the future it means that it needs to be the primary carer, not us.
Fantastic. And what would you say to anyone that's thinking of doing a similar course?
Do it.
Thank you.
Really useful.
Thank you.